Doctor, thanks very much for being with me this week. You and I have talked before about the treatment of heart, circulatory, and sleep disorders. Give us a little bit about your background and then how you got into this area of medicine.
Yes, thank you very much, Jim, for having me on your show. I'm a cardiologist and I've been here for 14 years in Las Vegas. I started my career at the University Medical Center where I was an assistant professor and the director of the cardiac catheterization laboratory at the University Medical Center. And I specialize in cardiology, interventional cardiology. And in cardiology, we have what is called as prevention and treatment of cardiovascular disorders. And in interventional cardiology, we try to perform minimally invasive procedures for the heart and the circulatory system. I also specialize in sleep disorders because sleep disorders have become a major risk factor for cardiovascular disorders. So at this time, I specialize in these fields and I practice these subspecialties.
Talk about sleep disorders, because when you and I talked before, I was fascinated that this was something that was actually recognized other than somebody having insomnia.
You know, it's very interesting. If you look at the history of sleep disorders was not described by a clinician. It was described by Charles Dickens during his posthumous papers of the Pickwickian Club, where he describes a young boy who used to snore and who was sleepy all the time, and he was called dropsy. But since then, many years have passed and we have come to understand how sleep affects the heart. The importance of sleep is the quality of sleep which you get. So anytime you get less than 6 hours of sleep or more than 8 to 9 hours of sleep, it's not healthy. Sleep disorders can be in various forms. You can just have sleep disorders such as insomnia, where people have a difficulty in falling asleep and staying asleep. But there is something called as sleep apnea, in which people tend to stop breathing at night. They may have difficulty in breathing at night, and thereby preventing the restful sleep which they should be getting at night. That translates into having medical problems in the future. For example, when you wake up, if you do not have restful sleep, there is a high incidence of people developing heart disease, high blood pressure. There is a lot of data to support that sleep disorders can cause diabetes. Atrial fibrillation is an irregular heartbeat that is significantly associated with sleep disorders. Congestive heart failure is associated with sleep disorders. And there are many other non-cardiac diseases that sleep can cause if you do not get adequate sleep, such as chronic fatigue syndrome, fibromyalgia, and many other diseases. And if you can identify and treat those people, you can help them live a healthy life.
You know, I have relatives and friends who from time to time will tell me or ask me, how much sleep do you get? And I say 8 hours. They say, well, I can do it on 4, and I've always done it on 4. And my feeling is that can't be done. Can it be done?
There are certain populations who are called as short sleepers, and they have been doing that from the beginning. But as you know, sleep is a process of regeneration. It's a restful period. So when you have a whole day of 24 hours, you need to be able to let your body regenerate, and all the regeneration takes place during sleep. It's very important, especially in kids, because nowadays with all the toys that are available, children are sleep deprived. They don't sleep as much as they used to sleep before. There is a lot of data to support that growth of children takes place during sleep. Now, similarly, if you want to function normally during the day, you have to be able to have adequate sleep. But you said before that there are certain people who are short sleepers and it really doesn't affect them. But what is recommended is that you should try to sleep for about 6 to 8 hours every day, and that will be able to regenerate your body and produce the beneficial effects of a good quality sleep.
As you get older, do you need less sleep?
Yes, when you get older, you need less sleep. The other reason is also when you get older, the quality of sleep changes. When you are younger, there is a stage called the stage 3 sleep and REM sleep, which are the deeper sleep episodes that take place that heals your body and rests your body. And you end up losing the stage 3 sleep and REM sleep in the older age. Also, the other concern is that when you get older, the older folks are more stoic. They don't really complain of tiredness and fatigue as much. But just because they don't complain of tiredness and fatigue does not mean that they're not sleep deprived. We see that all the time in the senior population, that they never complain. But just because they don't complain does not mean that they're not sleep deprived.
Well, I can tell you this. I'm getting a lot older and I complain a lot. Tomorrow, let's talk about the risk factors.
Thank you.
Thanks for being here. All right. Tell us about the risk factors of these diseases and how do you treat them?
Yeah. Yes, thank you very much, Jim. I think it's a very important topic, especially with the current issues in healthcare. Since I'm a cardiologist, I'm going to talk about, of course, the cardiovascular prevention, risk factors, and treatment of those disorders. It is estimated that more than 1 million people in the United States get affected by heart and vascular disease and stroke. One death every 40 seconds is caused by a cardiovascular disorder. More than 500,000 people get heart attacks every year. It is estimated that in the year 2030, that the cost of taking care of cardiovascular disorders is going to be more than $1 trillion. So it's very important to identify the group of people who are at a high risk of developing heart and vascular disease. You identify them, you educate them, and you treat them so that you can prevent the development of heart and vascular diseases. There are many risk factors that are available with ongoing research. We get to know more and more risk factors, and I'm not going to it's beyond the scope of this time period, and I'm just going to concentrate only on the major risk factors which we'll know very well, which are the traditional risk factors. So in my practice, I try to educate the patients. I think it's very important that we should be able to educate people as to what are the risk factors and how do we take care of those. It's interesting that the process of cardiovascular disorders begins very earlier on in your age, in your early 20s. It was found during the Korean War when they were doing autopsies in young soldiers. They found a process called the fatty streak, which is the initial formation of the plaque formation, which eventually progresses and clogs up your circulation and causes heart attacks and strokes. So that fatty streak can be found in very earlier on, and especially with the ongoing childhood epidemic, obesity epidemic, and all other issues that are going on, we have to be more careful of that. So the inside of your heart and the vascular system is lined by a membrane called the endothelium. It's the protective layer of your heart and the vascular system. So the risk factors can damage that endothelium and precipitate the formation of the fatty streak, which will eventually cause a plaque and rupture and cause heart attacks. I describe it just like having an intact skin. The skin protects your body from outside harm, from the outside risk factors. Similarly, the inside of the circulation is protected by the endothelium. So to keep a nice, healthy endothelium is very important, and the risk factors cause damage to the endothelium, which eventually causes heart and vascular diseases. There are many risk factors, but the most important risk factors are high blood pressure, diabetes, tobacco use, high cholesterol, obesity, diet, and inactivity.
Seems to me that of the the things that you've just mentioned, a lot of those you can control.
Yes, that's a very important question. There are certain risk factors which are non-modifiable. For example, age and sex. If you're more than 45 years of age and if you're a male, it's considered a non-modifiable risk factor. If you're more than 55 years of age and you're a female, it's a non-modifiable risk factor. Genetic predisposition to heart disease is also a non-modifiable risk factor. But if you have anything, a genetic predisposition, if you take care of yourself, you can modify that also. But most of the risk factors which I just stated to you are considered modifiable risk factors, and if you do a good job in taking care of that, you can prevent disability, heart attacks, strokes, have a good quality life, and prevent hospitalization. That's what we try to do as preventive cardiologists and interventional cardiologists.
So give me the disease and how you prevent it.
Yeah. So let's talk about high blood pressure, hypertension. It is interesting that there are more than 50 million people in the United States with high blood pressure. 1/3 do not want to know that they have high blood pressure. They're in some form of denial. And only 1/4 of those actually get adequate treatment for high blood pressure. And it's a big problem of being diagnosed and treated for high blood pressure. Your blood pressure should be 120/80. If your blood pressure is 140/90, it's considered high blood pressure. But there is a gray zone in between, 120 to 139 and 80 to 89. This is called pre-hypertension. Sometimes you may have heard the word, oh, my blood pressure is a little bit high. But the little bit high is not a good thing. 10 points higher than 120/80 increases your risk of, doubles your risk of heart attacks and strokes. So if you have risk factors for heart disease, if you have a family history or you are overweight, you should always get your blood pressure checked. And if it is abnormal, there are many methods that you can use to correct that problem with diet, exercise, and good medical management these days that is available.
Tomorrow let's talk about smoking, cholesterol, obesity, which is a big problem, isn't it? Diet and exercise.
And diabetes.
I'm learning a lot.
Thank you.
Thanks for being here.
Thank you.
We never seem to learn about smoking. We never seem to learn about cholesterol. We have a terrible problem now when you see these kids who are damn near square. They're so obese. Talk about those and what do we do about it?
Yeah, I think it's an excellent question. I wanted also to emphasize on diabetes because what happens with obesity is this is the highest risk of development of diabetes. When you have diabetes, which is a high blood sugar, you are considered somebody who has got heart disease. It does not matter whether you have any problems with your heart, but you are considered a coronary artery disease equivalent. So it's very important to understand that because diabetes eats your body from inside. It is the commonest cause of strokes, heart attacks, kidney failure and dialysis, amputation, and all these things can be prevented. The current childhood obesity epidemic that is going on, we are going to unfortunately diagnose more and more people with diabetes. It is estimated that there are about 26 million people in the United States with diabetes, out of which 16 million have been diagnosed to have diabetes and about 5 to 6 million have not been diagnosed.
So you're talking about 8% of the people.
Exactly. And the importance is that diabetes, the earlier you diagnose, the better it is. Like everything else, like all these risk factors we are talking about, the earlier you diagnose them, the better chances of you having a good quality life in the future. Because it takes many years, 10 to 20 years down the road, for all these risk factors to cause cardiovascular diseases. But the problem with diabetes is that by the time you are diagnosed to have diabetes, it has already been there for about 5 to 10 years. So if you're obese, or if you have a family history of diabetes, it's very important to go and get yourself evaluated for diabetes. And you have to start taking care of your health yourself. and go to your physician, get yourself evaluated. There is a blood sugar test called the hemoglobin A1C. It's being promoted by the national organizations such as the National Heart, Lung and Blood Institute and the NIH. That hemoglobin A1C tells you what your blood sugar levels have been for the last 120 days. It comes in a form of a percentage. If that percentage is less than 5.7, you are considered at a low risk of developing diabetes. 5.7% to 6.5% is considered pre-diabetes, and more than 6.5% is considered diabetes. However, these are just definitions. If you are in the range of pre-diabetes of 5.7 and 6.5, you already are at a higher risk of developing cardiovascular disorders. So it is very important to identify this group of people. The other question was regarding smoking. It is one of the most preventable causes of cardiovascular disorders and death in the world. 1 in 5 deaths in the United States are caused by tobacco-related causes, predominantly secondary to heart and vascular diseases. Somebody who smokes, his lifespan is shortened by about 14 years as compared to somebody who doesn't smoke. It clogs up your arteries, just like I said before. It clogs up your circulation from head to toe. There was an old textbook saying that you can choose between your legs and your cigarettes because of the high incidence of amputation and vascular disorders and heart attacks and all the vascular problems that smoking causes. So this is a preventable problem. And if you're never too late to quit smoking. Of course, the earlier you quit, the better it is.
Let's go back to diabetes.
Yes.
Define childhood diabetes as opposed to the other kind.
Yes. Now, the most important thing is there are many definitions of diabetes. There is a condition called maturity onset diabetes of the youth, or MODY. It's a diagnosis where even youth can have problems with their blood sugar. The pancreas, which produces insulin, it's a very small organ. So God has made that organ last for a certain number of years. So you have to be able to maintain a certain body weight for that pancreas to function normally, to produce insulin. Insulin is important for the metabolism of glucose and for the normal functioning of the body. So if you're overweight, what happens is that you produce more insulin because your body becomes resistant to insulin. It is resistant to insulin. So you need more insulin to be produced to produce the same effect. So if you lose weight, what will happen is that the body will have to produce less insulin, and the body will be more responsive to the insulin that is produced. That is called insulin sensitivity. Insulin sensitivity improves with weight loss. So that is why we emphasize weight loss in the younger generation, so that we do not overwork the pancreas. We do not have what is called as insulin resistance, which progressively develops into full-blown diabetes.
Are we making progress in the treatment of these diseases?
There is significant progress, even though there are great medications available. In addition to medications, we know so much about how to diagnose, prevent, and treat diabetes that if you get them earlier on, lifestyle changes, dietary changes with weight loss, exercise, and some of the medications that are available now as compared to 15 years ago. About 15 years ago, we did not have too many medications other than insulin and certain other medications such as sulfonylureas. But now we have such excellent medications that are called disease-modifying agents.
Let's do this. Let me interrupt you, and let's continue that part of the discussion tomorrow.
Thank you.
Thanks. All right. Talk to us about treatments for heart, circulatory, and sleep disorders.
Yes. So treatment for heart, circulatory, and sleep disorders, of course, is what some of it what I covered before. So first thing is lifestyle changes. If you have high blood pressure, you should try to decrease your blood pressure to the goals I had stated before. Try to get it less than 120/80, even though they recommend a blood pressure of less than 130/85. Nobody at this time knows what is the correct number, but lower the better. If you have heart disease, if you have diabetes, if you have any other problems, lower the blood pressure, better it is. So you need to be on a diet which is called a low sodium diet. There is a diet for high blood pressure which is called the DASH diet, which stems from the word dietary approaches to stop hypertension, which is a low sodium diet and a high potassium diet. Potassium diets are diets that are rich in fruits, legumes, and other things, and lower sodium diets. For cardiovascular prevention, there are diets that are, every time there are a lot of talk, there's a lot of talk about different kinds of diet. You may have heard in the news recently about this Mediterranean diet. So what it is you should try to have a diet that is low in fat, less than 7% in saturated fat, or a Mediterranean diet which is generally rich in what is called the monounsaturated fats and polyunsaturated fats. There are also what are the bad fat that is called saturated fat. So you have to minimize that. So foods containing a lot of olive oil, nuts, legumes, these kind of diets are supposed to be cardiovascular protective. There is these days a lot of talk about dark chocolate. It helps in cardiovascular prevention, and that is because there is a substance called polyphenols in dark chocolates that produces a hormone called nitric oxide, and it maintains that inner lining, keeps that inner lining of your heart healthy.
Does it work?
Well, anything that produces nitric oxide, it is supposed to be the molecule to prevent cardiovascular disease, to keep the circulation healthy. So there is a lot of data, there is a lot of work being done at this time. It is suggested that because it increases nitric oxide, it should help. The other treatments that are available, of course, are medical treatments in addition to the diets which I spoke to. Exercise, of course, is very, very important. At least 30 minutes a day of brisk exercise, a moderate intensity, preferably 7 days a week, but if you can do it 5 days a week, that should be sufficient. There are excellent medications that are available. Unfortunately, people are somewhat reluctant to use medications, but if you look at the benefit and the side effect and the benefit profile, if you take medications properly, it's only going to help your health. And there are excellent medications that are available now. There are various procedures that are available that you can perform to prevent symptoms and to prolong life. If you have heart disease, we can perform those procedures minimally invasive through the groin or through the arm, such as angioplasties, stenting, which is actually you put in a metal tube, a metal mesh inside your arteries. That can be done for many other blockages, such as aneurysms. These days we can do those procedures for vascular disease of the lower extremities.
But the guy on the street, my friends, I never hear him talk about any of this stuff. I mean, is the public aware of it? And if they are aware, what percent is aware? And then do they take care of themselves, or do they just say to hell with it?
I really think the problem we have nowadays is that we have so much of information available, and we have not been able to do a good job in educating the general population. Unfortunately, it is a combination of science and art. It's not that easy to be able to educate people. Sometimes you try to educate, and it's not an easy thing to educate everybody regarding cardiovascular prevention, because we have to stop doing a lot of things which we like to do. Like, for example, stop eating things which we like to eat. Everybody doesn't like to exercise. Everybody doesn't like to take medications. But I think if you can make people aware the importance of what is going on and make them take a part themselves in treatment, in diagnosing and treating heart and vascular diseases, I think you can make a big change.
It seems to me that the need to inform and to have the public know is maybe as great or greater than the treatment once you've found what's wrong with them.
I totally agree with that. I think what I generally try to do is, let's say somebody is diagnosed to have high blood pressure. What I tell them is that they should invest in a blood pressure machine. These days you can get a blood pressure machine for about $40 or $60, and that probably could be one of the best things you've done for yourself. You go, you measure your blood pressure in both arms. It has got two readings, the top number and the bottom number. So you should check your blood pressure 2 different times, 1 minute apart. You write down those two numbers, add up the two top numbers, divide that by 2, that gives you an average. The average readings are very similar to the readings that are seen in your physician's office. So if you have high blood pressure and you write down those numbers, you take your machine to your primary care doctor or your cardiologist. You put the machine on, check the blood pressure when you're in that office, so that you can compare what the blood pressure is at the physician's office. If you develop that kind of a practice, the physician also will be very much interested to make you understand, because you're taking an interest yourself. And this way you can contribute yourself to your own health. You don't, in addition to getting help from your physicians.
I'm fascinated.
Thank you.
I don't know whether I'll go out and buy one of those machines or not. Tomorrow let's talk about sleep disorders, because when you were in my office and we were talking,
yes,
I found this just to be fascinating.
Thank you.
Thanks for being here.
Thank you.
In 6 minutes, tell me all you know about sleep disorders.
So sleep disorders, it's a fascinating field. Sleep disorders have been associated with, the biggest correlation with sleep disorders actually is in cardiovascular disorders, because the same risk factors that cause cardiovascular disorders are present in sleep disorders. So one of the most important things is obesity. And sleep disorders can affect all age groups: children, adults, older folks. The commonest reason is having a smaller airway. So you can have a small airway if you have a problem, or if you have a malposition or structural issues such as a small airway. The commonest reason for sleep disorders is obesity. Because what happens is that when you have a big neck, or if you're more than 17 inches, your airway, the upper airway becomes small, and it causes problems when you go to sleep. The reason it causes problems when you go to sleep is that when you go to sleep at night, when you get into your deep sleep, which is called the REM sleep, your brain is active, but your body is paralyzed. It's a very interesting phenomenon. And if you have a predisposition to develop sleep disorders, you end up having sleep apnea at night.
So what do you do about it?
So one of the most important things to do is, of course, weight loss. If you lose weight, you can, if you have mild to moderate sleep apnea, you can eliminate sleep apnea. But if you have severe sleep apnea, you can definitely decrease the severity of your sleep apnea. In children, there is a lot of data to support that if they are snoring, you should get yourself evaluated by an ENT doctor, because snoring makes them breathe from their mouth, and that prevents them from developing a normal airway, because 70% of the lower half of the face is formed by the time a child is about 7 years of age. So it's very important that they you help them have a normal growth of their face. The treatment, of course, like I said, is weight loss. Avoid alcohol. Alcohol also causes paralysis of your upper airway at night, and we can hear that. When we speak to people, we find that all the time, that he doesn't snore when he's fine, but when he drinks, he snores, because alcohol causes paralysis of the upper airway and predisposes you to develop sleep apnea.
What about age?
Age, in
other words, do you tend to have those problems as you grow older?
Oh yes, yes. So you can develop sleep disordered breathing. Once you have sleep disordered breathing, it only gets worse with age. Like I stated before, in the older folks, there is a big incidence of sleep apnea, but because they do not complain as much, they do not complain of any tiredness, fatigue, or any of those symptoms, we tend to underdiagnose them. Even in children, sleep apnea, it causes them to be more hyperactive than being tired and fatigued. So we tend to miss children with sleep disordered breathing as well. So, but when you get older, it gets worse with time, unless you take remedial measures. The gold standard of treatment is, of course, what I said, is to lose weight. At least about 10% of your body weight, you can prevent the course of the disease. There are certain other methods, which is the gold standard, is what is called as the CPAP therapy, in which we treat people with a mask that can fit into your nostrils or around your nose or mouth, that opens your airway when you go to sleep. People are somewhat apprehensive with that because of the bad rapport sleep disordered breathing and the treatment has had in the past. But nowadays, with specialization and with good sleep doctors, we can have excellent results with that.
Talk about anxiety.
Yes.
Because I don't sleep very well when I'm worried about something.
Yeah. So when there is something that is called as cognitive behavioral therapy, and that is like a psychological process which we try to encourage people, that prevents them from going to sleep. And then also, a lot of the times when they go to sleep, it wakes them up in the middle of the night and they have what is called a sleep maintenance insomnia. Now, that is not necessarily due to sleep disordered breathing. It is a kind of an insomnia because your mind is so active. So what you really need to do is you need to change your lifestyle. You should try to, of course, exercise. If you exercise, you should try to exercise in the morning, because by the time you're at the end of the day, you're tired and you will go to sleep at a certain time. You should always try to sleep at the same time and get up at a certain time. So that's called sleep hygiene. You should avoid doing things that stimulate your mind before you go to sleep. Like, for example, avoid caffeinated drinks, sodas, coffee. Avoid watching computers till late in the night, because there is a hormone called melatonin that helps you go to sleep. And whenever you come in contact with bright light, it delays the production of melatonin, and that can prevent you from going to sleep. So there are many other facets of cognitive behavioral therapy, in which there are many relaxation techniques, reading books which are not too stimulating, like mild reading. All these things can help you go to sleep.
How do you stop my anxiety?
Exercise, according to Freudian theory of prevention, actually exercise and
or quit
lifestyle changes.
Quit my job and go to the mountains.
That helps a lot. That helps a lot.
Thanks for being here. I've learned a lot.
Thank you very much
We'll
for
have you
having me.
back.
Thank you.